Hello, good morning.
Good morning.
My name is Glory and I'm the assessor for the station. The station timing is 15 minutes. All the documents you require for the station is kept on the table near the drug trolley. A sharp pen is provided and an electronic BNF as well. There will be a video recording of the station for evaluation purpose, and I will initiate the timer only when you're ready. Now you can look into the video camera, introduce yourself with your full name and your candidate number.
Anita Preeti DeCosta, candidate number 012345.
I will now give you a few minutes to have a look around and check if you're happy with everything. Are you ready?
Yes.
Your 15 minutes starts now.
My scene is safe for me to approach without any slip and trip hazards. I draw the curtains, pull the doors and windows to provide privacy and dignity to my patient. I gel my hand using WHO guidelines. Palm to dorsum, fingers interlace, fingers interlocks, rotation of the thumb, tip of the finger, rotation of the wrist. My hands are clean. Drying it for 30 seconds. Good morning. My name is Anita. I am one of the nurse who is taking care of you today. So I am here to give you a medication for 12 hours. Before proceeding further, may I know your full name and date of birth, please?
Right, sure. So my name is Jose de la Cruz and my date of birth is 1st of December 1970.
Yeah. Can I see your wristband? My patient's name is Jose de Cruz with the date of birth 1/12/1970 with the MRN number 0137898. My patient's three-way identity is correct across the documents, the patient's verbalization and the wristband. I'm happy to proceed. I'm with the right patient. Moving on further, I would like to know, do you have any allergies to your medication, food or latex or anything else?
Yes, I do have an allergy for ibuprofen.
What do you feel when you have the ibuprofen?
Well, I usually have rashes and urticaria, itchiness.
Okay, I will document correctly in your hospital records and I'll see that you will not come across any of the ibuprofen content in your medication. Is that okay for you?
Perfect, thank you.
Okay, before proceeding further, I would like to know, are you in a comfortable position? Do you have any breathing difficulty?
No, I am okay right now.
Okay, do you have any pain?
Yes, but my pain subsided, so now I can say it's a bit better.
Okay, can you rate your pain in the universal pain score with the 0 being no pain and 10 being excruciating pain?
Well, I can say it's now on 3/10.
Okay, have you taken any analgesics within 4 to 6 hours of timing?
I just can't remember, but I think I'm not aware that I did have a pill.
I'll check in your documents. If any analgesics further, I'll talk to a doctor and I'll administer. Is that okay for you?
Yes, please, thank you.
So I'm going through with my prescription now. My patient's name is Jose de la Cruz. Date of birth 1/12/1970. MRN number 0137898. Height is 1.57, weight is 74, body surface area 1.80. Medical assessment unit, date of admission is today at 7:05. Consultant name is Dr. Smith. Number of prescription is 1. The prescriber's name with the GMC number and bleep number with the signature is present here. It is correct and legible. Details of the persons administering medication are here. As I am going to administer the medication for 12 hours, I will be entering my details in. Allergic status of my medication is mentioned here. My patient is allergic to ibuprofen, which causes rashes. The prescription is correct with the prescriber's name, bleep number, dated today. There is no any other medication risk factors. Moving on to the next page, my patient's details are correct and complete and legible as mentioned earlier. The medication non-administration codes are mentioned in the prescription chart. If in case if I am not administering any of the medication, I will pick the right code and mention in the prescription. So moving on to the once only medication. First medication is paracetamol, which was administered today 1 gram intravenously as a start dose at 8 hour. The prescriber's name and signature with a bleep number is present. Two persons has checked the prescription and they have signed in here. Moving on to the next page. My patient's details are correct and complete and legible as mentioned earlier. The prescribed oxygen now. Examiner, may I know my patient's saturation level?
It's 95% on 2 liters of oxygen.
So as the patient has an ongoing oxygen, I am putting my signature here. The codes for starting device and modes of delivery are mentioned in the chart, which are correct. Moving on to the next page. My patient's details are correct and complete as mentioned earlier. I'll move on to the first medication, that is antimicrobial. The first drug is amoxicillin. Dose is 500 milligram. Frequency of administration is thrice daily. Route is per oral for 5 days. So he has not started with any of the antibiotics. I am administering the first dose of antibiotics now, but the frequency of administration is wrong in the prescription chart. I will escalate this to the prescriber and I will be correcting it further. So prescriber's name, signature and the brief number with the printed name is present and the prescription is legible. The amoxicillin is 500 milligram tablets with the expiry date 9/24. I am happy to proceed. There is no any other antimicrobials prescribed. Moving on to the next page. My patient's details are correct and complete as mentioned earlier. Moving on to the regular medication. First drug is atenolol. Dose is 25 milligram twice daily per oral route for 5 days. Since patient has low blood pressure, the previous dose has been not administered. Now the blood pressure range is more than systolic blood pressure is more than 100 mm of Hg. I can give the blood pressure tablet now. Is that okay, Joe?
Yes, you may proceed.
So I'll be administering atenolol 25 milligrams. The expiry date is 8/24. I'm happy to proceed. And third medication is paracetamol. 500 milligram 6 hourly per oral 7 days dated today. But the start dose is given at 8 am and hence I am skipping this. I'll put the correct code. But the prescription is correct, legible with the prescriber's name and signature. Next drug is docusate sodium. 100 milligram. Frequency is thrice daily for 7 days dated today. Prescriber's name, signature and the print name is present. The prescription is legible and valid dated today. So I am happy to give docusate. Docusate sodium 100 milligram. Expiry date is 10/24. I am happy to proceed. So moving on to the next page, my patient's details are correct and complete as mentioned earlier. As required medication, the drug is salbutamol inhaler. Examiner, may I know my patient's respiratory rate, please?
It's 19 breaths per minute.
Okay, thanks for confirming. And Joe, do you have any breathing difficulty at the moment?
I'm all right.
So as my patient is not having any breathing difficulty and the respiratory rate is normal, I am not administering the salbutamol inhaler. There is no any other medications prescribed. Moving on to the next page, the patient's details are correct and complete as mentioned earlier. No infusions are prescribed. There is column for the omitted doses of medication. As I have omitted the paracetamol at 12 hours, I will be mentioning the medication with the correct code.
It's another.
So, I will proceed with the 3 medications now: amoxicillin, atenolol and the Docusat. So, amoxicillin,
Yeah.
500 milligram, 1 tablet. Date of expiry is 9/24. So, next tablet is atenolol, 25 milligram. Date of expiry is 8/24, 1 tablet. And the Docusat sodium, 100 milligram, 1 tablet. Date of expiry is 10/24.
You have 5 more minutes.
So, here are the 3 medications. I will be administering your antimicrobial, that is amoxicillin. It is useful in treating your infection, usually given for pneumonia, bronchitis, any of the nose, throat, ear infections and urinary tract infection as well. But if you have any renal or liver conditions, it is contraindicated. So, along with the administration of antimicrobial amoxicillin, we will be monitoring your renal and liver functions. So, next medication is atenolol, which is an antihypertensive, which is used to treat your hypertension, sometimes for angina pectoris and myocardial infarction as well. But it is contraindicated in some of the heart conditions and COPDs. So, next drug is a Docusat, which is your laxative, and it is used in the treatment of constipation, and it is contraindicated in inflammatory bowel disease. As you have no allergies to these drugs, I am happy to proceed. And before proceeding, I would like to check all the rights of drug administration. I have picked up the right drug with the right dose. I am doing it as a per oral method, that is the right method of administration and right dose as well, and at the right time and right date. There is no diluent is used for particular medication. And I will be checking again the allergies. Can you confirm me your allergic status? Are you allergic to any of the medication?
No, I don't have allergies to those medications.
So you have only allergies to ibuprofen.
Allergies are ibuprofen,
So, okay,
confirmed.
thank you for confirming it. So can I check your wristband again?
Okay. So my name is Jose de la Cruz. My date of birth is 1st of December 1970.
Okay, my patient's name is Jose de Cruz and date of birth 1/12/1970 with the MRN number 0137988, and I am with the right patient. I am happy to proceed. So, my patient's prescription is clear, legible and correct with the prescriber's name, signature and bleep number. The validity and legibility of the prescription is correct and there is a signature of the prescriber. I am happy to proceed. So, I will be referring to the electronic BNF in case if I have to give any further information about the medication. So, before administering, can I confirm that you are not nil by mouth and you don't have any swallowing difficulty?
No, I don't have any swallowing difficulties, and as far as I know, I'm not ill at all.
Okay.
Thank you.
Here you go.
Okay.
Here is your medication.
Okay.
Can I see that you have swallowed the medication? Okay, thanks for confirming. So, as I have confirmed that you have swallowed all the medications, I will be recording on my medication chart. So, I will be here. If you have any allergic reaction or if you feel any discomfort, you can let me know.
Okay.
I will leave the call bell here.
Okay.
So, if in case you need me, you can ring the buzzer I'll be here to help you.
Thank you very much, Ernst.
Thank you for your cooperation. I'll be throwing all the utilized things in the orange bin. I'll gel my hand using WHO guidelines, that is palm to dorsum, fingers interlace, fingers interlocks, rotation of the thumb, tip of the finger, rotation of the wrist. My hands are clean. Thank you, Joe. Thank you, Assessor.
Thank you very much.
Thank you. And this is the end of the station. You'll be moving on to the next station now.